Oh, this is one of our regular patients, bless them, and they came in for an emergency appointment. Basically what they'd done, their ear canal was itching, so they used a cotton bud, naughty patients, and what's happened is the end of the cotton bud, the end of the Q-tip has come off inside their ear canal. So they turned up and saying, look, is there anything you can do? Because I'm really struggling, I can't hear anything, and I'm afraid I'm going to get an infection. So we brought them through as an emergency appointment. You can see the tail end of this cotton bud here. We're just going to draw this down the canal. Look at that. It wasn't a small piece that came off, it was the whole end of the cotton bud as well. You can see there's a little bit of oil in there as well. So I think the patient had tried to kind of shift it along with a bit of oil, but it came out really, really well. Now, this particular patient tends to suffer with a much more sort of softer, stickier type of earwax. It's very deep in the canal, so we're heading down to that osseous portion. And what we've also got is a really pronounced first bend in here. So you can see we're struggling to get around that corner. And remember, when we talk about ear canals, we talk about them having an elongated S shape to them. Okay, so we have first and second bend in the ear canal. Now, obviously, the severity of those bends varies so much from patient to patient. And when we're putting the endoscope in, the endoscope is basically it's a rod endoscope. So you imagine a very thin but straight piece of metal that we have to get in there. Now, if you've got to negotiate those bends, if you've got quite a severe one, it's a lot harder to negotiate and sometimes get a really clear view without pushing the sort of ear canal, the entrance to the ear canal open a little bit to be able to get that angle to be able to see the view. So what I'm doing here now, we've got rid of the cotton bud, we've got rid of some of the softer wax. I'm just literally tidying up some of this drier skin material. So this is actually keratinous, so it's epithelial skin that's died off and filled with keratin. It hasn't managed to migrate out. Now, this patient has this issue quite regularly, so they're coming about probably every 6 to 9 months they'll be able to get that out. But we're taking this away really nicely. Fine end on here just to minimize any risk of clarinetting. Clarinetting is when you get the debris that you're trying to take away vibrating up and down inside the end of the suction tube, and it causes a really shrill, quite loud and high-pitched whistle, which is not pleasant for the patient. So we've just minimizing that by using a much finer tube, so a much smaller aperture at the end, which is just going to minimize the risk of that vibrating up and down. Now, we can see, you can see how pronounced that bend is. I can barely see around the corner here, but you can just about see a little bit of wax down on the tympanic membrane here. Let's give this a little bit of a lift. So in that sort of posterior section of the tympanic membrane, don't forget, anterior face, posterior, back of your head. Okay, if we refer to it into medical terms on here. There we go, let's take a look. There we are, eardrums looking lovely and healthy. All looking good, nice and clear. So there's the end of that Q-tip, the end of the cotton bud there. So we're going to say it's 2 centimeters worth of debris, 3/4 of an inch there as well. Well, guys, don't forget, if you do enjoy the videos, you can I always forget to do this till the end. Like, heart, share, follow, and subscribe for me. If you have ear problems yourself, make sure you check out the link tree in the description, or on TikTok now you can hit the call button. You can get straight through to our reception staff here who can gladly book you in, or if you want to check out our locations or anything about us, check out the link tree in the description. It's all on there for you as well. Thank you very much for watching the video again today, guys. As always, take